Whichever. All right. Well, thank you very much for joining us today for this press briefing on how the state is slowing the spread of coronavirus in Nebraska. Before we get started, I do want to let people know that someday it will get warm in Nebraska again. We particularly challenged with that here in the Capitol building. And as always, we want to remind people of our 6 rules with regard to social distancing and to keep Nebraska healthy. Again, we want people to don't take unnecessary trips outside the household. Work in a way that is going to be socially distanced. You know, keep that 6-foot distance between you and other people and avoid groups of 10 people or more. You go shopping once a week and don't take the whole family. Help kids socially distance by keeping them at home to play. Help seniors socially distance by running errands for them so they can stay at home, but don't go visit them in long-term care facilities. And of course, number 6, exercise daily at home or in a socially distanced sort of way. So again, remember our 6 rules. As we go through the month of May here, we've started loosening restrictions. However, it's important to be able to make sure that we continue to practice good social distancing so that the work that we've done so far to slow the spread of the virus continues to be in fact in the state. Hospitals, we talk about hospital data again. So again, this is the whole reason we're putting these restrictions in place is to make sure we preserve our healthcare system. We've got 46% of our hospital beds that are available, 40% of our ICU beds available, and 76% of our ventilators, 78% of our ventilators available. So again, all the steps we've taken have worked. We've preserved the hospital system here in Nebraska. And again, testnebraska.com, again, we want people to sign up for this, testnebraska.com. It's a great way to be able to help the state get an idea of what's going on with regard to the states, how we're scheduling testing. And a couple of announcements with regard to this. So whenever we bring on a new lab, and that's what testnebraska.com is, it's a new lab set up here at St. Elizabeth's in Lincoln, we have to integrate the data from that lab into our data streams at the state so that it can all be reported out onto our public dashboard so that it can be delivered to our local public health departments. So just like every other lab, the lab for Test Nebraska has to go through that as well. And I'm very pleased to report that now we have gotten that all in place. So starting last night, the public health directors will be able to see those lab results. So people were obviously getting informed of their test results through the email that was going out through Test Nebraska, and they were getting that in that 2 to 3 time frame, 2 to 3 day time frame generally. So we're trying to get that back to the individuals. We got the data stream integrated into the public health department, so they will see that starting last night. Actually, they started seeing it, so they can follow up and start doing the contact tracing on that. And then one of the other ramifications of that's going to be, though, is that starting today, that data is going to start showing up in our public dashboard. So you're going to start seeing an increase in the number of tests that we've run here at the state of Nebraska. So again, that's one of the things that you'll start seeing tonight as we, again, the state, we update our public dashboard at about 5:45, 6 o'clock. You'll start seeing those tests from Test Nebraska show up in that website. One of the other things that we did a few days ago is we started opening up more people into Test Nebraska with 65 years and older. That created a rush of people calling into the phone lines that was being handled by Poison Control. And so what we've done is we've changed the process. Paul, this is for you. You asked about this yesterday. Took us a couple of days, but we got it done. So now we actually have a new call center that is going to be handling the phone calls for testnebraska.com to be able to answer people's questions. That phone number is area code 402-207-9377. Let me give that phone number again. testnebraska.com. Call center is 402-207-9377. So again, the folks from Utah who helped set up our program are going to take over the call center. They've already got one set up. So they're obviously familiar with the software and everything, so they'll be able to help answer people's questions and so forth. So that's who's going to be doing it. Excuse me? People will not be able to apply for tests. This is just to answer questions with regard to the current program that we've got right now. It's actually answered in Utah. So again, call center, these are the folks that are familiar with the software. Also, one of the things you may have been reading about is REM Desaver. REM Desaver is the drug that Gilead Sciences has been developing as a treatment for coronavirus. It's used generally for people who are more severely impacted and have been on a ventilator for a long period of time. And Gilead Sciences is committed to supplying 607,000 doses of that across the country that would help over 75,000 people. The federal government, through the Department of Health and Human Services, is distributing that. Nebraska has received our share, or initial shipment, of 400 vials of that. And so that will serve approximately, I think we just determined about 50 people maybe, something like that. So Dr. Antone is putting together a team about how those will be distributed and so forth. So we're working with health systems here in Nebraska to be able to do that. But again, REM Desaver will be starting available, and we'll work with the health care systems to be able to distribute those out to be able to help folks who, again, the most severely impacted who are on those ventilators. But appreciate the federal government in helping get that supply to Nebraska. So one of the things that we've talked about is that a number of organizations here in the state of Nebraska have been impacted by this pandemic. And nonprofits have been impacted just like businesses have been impacted, like state government's been impacted, like local government's been impacted. And in particular, for example, we've had some of the food banks up here talking about the needs there, because we've seen people who have a greater need for, they've got more food insecurity and so forth. And one of the things that the First Lady has done through Nebraska Impact, the Nebraska Impact COVID-19 Relief Fund, to be able to help raise money for those organizations. So the First Lady has been here before to be able to talk about that, and so we're bringing her back again to talk about that a little bit more. So our First Lady, Suzanne Shore, honey, if you come up and say a few words, you're up.
Am I supposed to sanitize?
You can if you want. That's always a good idea.
I thought that was my rule.
Go
All right.
before and after is always good.
Thank you very much for letting me be here. I appreciate the opportunity, and I have a few things I have to talk about, so I'm going to speed through as quickly as I can. I wanted to start off by giving a bit of a report on the COVID Relief Fund, the COVID-19 Relief Fund that we started up as an effort to help mitigate some of the impact of the pandemic across Nebraska. And I want to thank some of the organizations that have really made significant contributions, and that includes Walmart, Tri-State Generation Transmission Association, the Claire M. Hubbard Foundation, Black Hills Energy, and Mutual of Omaha. These organizations, along with others and a lot of individuals, have made donations, big and small, and really made an impact for what we can provide. And if you want more information on those, you can go to NE, that's the letter N, letter E, impact.org. We started out by providing some refurbished laptops and tablets to some of the low-income students. And then Nebraska Children and Families Foundations came forward, as did school districts, and started providing those devices. And we want to thank Motherboard in Omaha and working in conjunction with us for that. Since then, the majority of our funds, about $250,000, have gone to provide emergency food assistance in areas that we're experiencing as hot spots for virus outbreak. And because of the flexibility that this fund has been providing, we've been able to jump in the day we find out that there's an issue and go in and help provide resources until the state and other nonprofits can step in. So we've kind of found ourselves to be the crisis responders in a lot of these situations. The majority of our funds have been distributed to provide assistance to Dakota, Madison, Hall, Dawson, Colfax, and Platte counties. And just an example of what we have been able to accomplish. This is a small one, or this is just one. Thanks to the generosity of donors, in South Sioux City, the Growing Community Connections Collaborative was able to go out and purchase enough food from Walmart, who is one of our supporters, to fill 100 boxes for families. And then 10 teachers of South Sioux City schools lined up, filled the boxes, and got them out to those 100 families. And this week, boxes are being made because of the large number of families being quarantined. And again, this is just one of the counties that we've been able to impact. We continue to see needs, and there's still a lot of work to be done. There are families who are struggling to get food and pay for housing and utilities. We've raised a total of $340,000, and we spent $260,000, so a big chunk. We'll continue to try to raise funds and do everything we can to help our partners across the state and all of the Nebraskans. And I want to thank everybody for all their generosity. It's really been a ray of sun throughout this emergency. I ask anyone who's able to consider contributing either to the COVID-19 Relief Fund or to your local food pantry or nonprofit who's providing services. If you're interested in helping us out, you can go to neimpact.org. You can even donate on that website. You can always support the Food Bank of the Heartland. And don't forget, you can always give blood. Another way you can contribute is to provide food or face masks for Nebraskans. I'm on these calls with community collaboratives all the time, and across the state, I have started hearing about how people don't have access to the face masks. And one of the concerns is I'm hearing this from food banks. And so people will come in and not have a mask, and that puts them and the community at greater risk, just as these people are going out in public to try to get food for their families. So if we can provide masks for the people in some of the hardest hit communities, we can really make an impact on the health of our state. So I am asking all the wonderful and talented seamstresses, both expert and novice, to sew and donate cloth masks for those in need. You can deliver those masks by mail to the Nebraska Impact location in Lincoln, and that address is on our website. Or if you prefer to deliver them personally and you live in Omaha or Lincoln, then you can email us, and that information is on the website, and we'll make those necessary arrangements. Also on the website, you can find tutorials on how to make the face masks. Again, and that's on neimpact.org/masks. And last, I need to say a few words of thanks to the community collaborative partners across the state that work with the Bring Up Nebraska initiative. I've already mentioned community collaboratives several times today, and it probably deserves an explanation. For those who don't know, Bring Up Nebraska is a community-based initiative that brings together a community's critical players to provide prevention, support, and services for families. So community-based, prevention, collaboration. And when I first started this whole First Lady gig, I began working with the community collaborations as well as Nebraska Children and Families Foundation to help improve child welfare and well-being in the state. And they've just proven powerfully successful. In 2 years, because of the work of the community collaboratives, we brought down the removal rate from children being removed from families in 2 years by 20%. That's amazing. And we become an example of excellence across the nation. So these collaboratives started with improving child well-being, but they become a whole lot more. In 2019, these were the groups that stepped up when we had flooding, and we needed communities to come together and come up with solutions. They stepped up as the leaders and providers in that rebuilding, and they're doing it again with this COVID emergency. And most Nebraskans don't even know they have a community collaborative or who these hardworking people are and all of their amazing work. They include your communities, or many of your communities, leaders in nonprofits, government, education, healthcare, law enforcement, now public health, and business. They all meet regularly. They talk about what's happening in their town and county and what needs to happen to make things better, and then they get it done. And lately, they've been working tirelessly on responding to the coronavirus. They communicate constantly with each other about the situation, what's needed, and then they let state leaders, government officials, funders all know, and then they start delivering those solutions. And they're making sure people are fed and safe, kids are cared for and able to participate in classes. The quality information on the virus and protecting yourselves is given to all Nebraskans. One quick example, I called on them and they gave me answers when the governor was looking for videos to make in non-English. Because of their input that day, we were able to create videos in 7 different languages on protecting yourselves and your family from the virus. Again, this is a tiny example. They're working to resolve statewide and local issues involving a breadth of things: connectivity and broadband, child welfare, food security, mental health. The list goes on and on. So I just want to thank these collaboratives and all their partners. I also want to thank DHHS for being so responsive. Their leadership, work, and guidance in this emergency has just been invaluable. All right, and at the end, I just want to say thank you to everyone who has stepped up, and I think that's every Nebraskan. I know that this is difficult on all of us and that we never expected to be here. But I also know we're on the right path. I know what's going on in the state, and I am really impressed. And I appreciate everyone's strength and sense of community and resilience. And I keep saying this is a curse and a blessing. We keep seeing so many needs and challenges, but they have been equally met with great leadership and generosity and community support of our neighbors. So thank you very much. I know we're going to get through this together, and we really are going to come out better. So thanks. All right.
Thank you, honey. Okay. So this is also Skilled Nursing Care Week in Nebraska, and obviously our healthcare workers have been on the front line with regard to fighting the pandemic here in our state, and no more so than the folks who are working in our skilled nursing facilities. We've got Jennifer Cerno from LeadingAge Nebraska, who's with us in the audience today, and also Heath Bodie from the Nebraska Healthcare Association. And Heath, I'm going to ask you to come up and say a few words with regard to what you're hearing from your members and how they're responding to this pandemic to work to keep their residents safe.
Thank you, Governor Ricketts. I'm honored to be here today, along with my colleague Jennifer Cerno from LeadingAge Nebraska. You know, the honor comes from the opportunity to lift up the great work and the great care that's happening across the state every single day. And Jennifer and I knew at the outset that we represent providers that are caring for Nebraska's most vulnerable. And you have heard us use that term a lot. They're in a war and continue to be in a war with this virus. So these long-term care providers get up every day and use their diligence and their passion to continue that care, to make sure that the care that the Nebraskans are receiving is of high quality, to make sure that we're connecting Nebraska's most vulnerable, those elders, with their family members in whatever way that looks like in today's world, and to make sure that they're staying engaged. I've really been appreciative of the governor's emphasis of long-term care, specifically of skilled nursing care and assisted living care. Whether it be from the governor making sure that we're a high priority from education, from supplies, whether it be his willingness and his actions to loop us in, both Jennifer and I and those members, with the communications that are so critical as we've learned together about how to work through this pandemic. It's been an interesting week, and it's a fun week of celebration with National Skilled Nursing Care Week. And I don't know if you know, but earlier this week, CMS Administrator Seema Verma had penned a letter to long-term care providers, and she shared her appreciation for their diligence in caring for these Americans, for making sure that they're connecting those Americans with their families in whatever way that looks like, similar to our thoughts, and to making sure that they're safe and have compassion wrapped around them. You know, the one thing that's remained constant in this is the great stories. And so those stories can be of, as the governor talks about, team members out there on the front lines. Early on, we saw stories of teams that said they're going to do everything they can to keep this virus out of their community. So maybe they brought RVs into the parking lot, or we know of a facility in northeast Nebraska that stayed there, their entire team, without leaving for well over a month to make sure they did what they could. And then this week, with National Skilled Nursing Care Week, to adapt the programs and the celebrations to make sure that those elders in their care stay safe, but that we're still celebrating and lifting up what's good in the days in front of us. These courageous team members are the ones that get back up every morning in the face of this adversity and realize the important job that they have in this work for caring for Nebraskans. They bring back that passion, and as I like to call it, they bring that grit, and they say, we're going to do what we can to serve well, to care well, and to make sure that these elders are as safe as they can. Jennifer and I have always been proud to be around and to serve these members through membership. But I can tell you, as we've watched that passion, that tenacity, that grit unfold in this pandemic, it makes us even more proud. So today, again, in this time of National Skilled Nursing Care Week, we're celebrating those team members, their efforts, their diligence, their tenacity to keep the positive aspects of the care that's out there, to make sure that elders are staying connected and to make sure that they're staying engaged. And I would just challenge you as Nebraskans to consider this an opportunity to rally around those skilled nursing facilities and those assisted living facilities in your area. rally around the care that's happening to those elders and the family members that are struggling with some of the disconnecting, that we can't physically touch each other right now, and those team members that get back up and do it again day after day. Governor Ricketts, thank you again for highlighting this important work, and I thank you again for the honor to be here today.
Well, thank you, Heath, but Heath, don't go too far away. Don't go more, just 6 feet away would be good for right now. Because in recognition of all the great work that is going on in our long-term care facilities, I want to sign this proclamation proclaiming it National Skilled Care Nursing Week in Nebraska. And ask you to accept this on behalf of your members, for both you and Jennifer. We're grateful for all your work, and I believe that facility you were talking about, wasn't that Greeley?
It was Greeley.
It was Greeley where they, yeah, it was very impressive what they did there, so thank you very much on behalf of all your members.
Thank you, Governor Ricketts.
All right. Thank you. Thanks. In addition to thanking all of our folks who are working in our long-term care facilities, I also want to recognize the poll workers that worked yesterday to be able to make sure that we could very smoothly carry out our primary election. As you all know, we had a record turnout, not so much at the polls, because a lot of people mailed in their ballots, but I do want to thank all the poll workers and proclaim today Poll Worker Appreciation Day here in Nebraska for all the great work that the poll workers did yesterday to make sure and ensure that we had a smooth election. So thank you to all the poll workers yesterday. And that we'll keep for the Secretary of State. Okay, then we've got just the schedule for this week. English briefings each day at 2 o'clock Central Time. Spanish briefing tomorrow at 5 p.m. Central Time. And then NET, I'll begin on NET at 8:30 p.m. Speaking of Nebraska. Now we'll go ahead and get into our Q&As. Melanie Standiford from KNOP. Can we get some clarification on rules for bars? So again, for bars, we have them operating without patrons in the bars. They can do carry-out, delivery, curbside service. And we signed some executive orders with regard to, being able to mix drinks and everything, but they cannot have patrons inside their facilities. Many people are asking why some bars can open if they have no kitchen and others cannot. What kind of food qualifies as food to serve so that alcohol can be served, popcorn, frozen pizza, or is the bar required to have a fully functioning kitchen? So again, if you have a food license, you already know if you can serve food. If you don't have that license, then you cannot. So this is not about being able to pop popcorn or provide appetizers. This is, again, meant to cover bars who are also, the bar and grills who are doing meals in restaurants. So it's half your dining capacity. If you're not licensed to do that dining capacity, then you actually cannot do it. So, if you have any questions though, please check with your local public health department. That's a great place to start. Lauren Coomer, NTV. For COVID-19 test sites, not the ones part of Test Nebraska, I was told they were going to release your test between 24 and 48 hours, but got called with results exactly 1 week later. Are they prioritized positive tests? Where are the tests being sent to, and does that play a role in how long it is taking? So again, our goal for the public health lab is to be able to get those response back, or any of our labs, from 48 to 72 hours. When we bring on a new lab, as I said, we got to bring them into our data stream to be able to make sure that goes to the public health department folks. And so sometimes there might be a delay there. Also, when we began this pandemic, I know the commercial labs were sometimes taking 4 to 7 days to respond back. So typically we are getting back in that time frame. And so, and we are calling people who are negatives as well. Obviously, the positive people are a greater priority for us to be able to do that. So there could be a number of reasons why that took a week to get back to you, but obviously we're trying to get that information back as quickly as possible. Charlie Brogan, KFOR. Will a Test Nebraska testing station remain open in each community until all the signups in that community have been tested? If not, what will be the criteria for moving the station in another city? If I understand the governor correctly, the goal is to have 6 testing stations doing about 500 a day. Yes, Charlie, so as we ramp this up, that's where our long-term goal is, to get to those 6 mobile testing sites that will do 500 a day. We will not necessarily keep a site in a city until all those tests have been run. We are scheduling about, 3 or 4 days out, but we also are going to maintain the flexibility that if we need to move that site to someplace else because there's a greater need, we will do that. So obviously, we're going to try and get through as many tests as possible in the time frame we've got those operating. Right now, we're operating Test Nebraska in Omaha and Lincoln today. We're going to be going to Norfolk tomorrow, Lexington on Friday. So we do, again, they're mobile testing sites that will move around. Also, I just covered this one. How far out does the scheduling software go? Is the no times available answer being returned to those trying to sign up simply because the software only goes out a few days? So again, right, so we open up the test slots for a few days that we know that we're going to be in that location. If we haven't made the decision on how we're going to extend that, then right, if we run out of slots, you won't be able to schedule that time frame. So you got it right there, Charlie. Melanie Wilkinson, York News Times. Another question from York readers. There are people walking around with gloves on, going into stores, pumping gas, etc. Isn't that a fake sense of security and actually a hazard because they are touching all sorts of surfaces and their faces, thereby promoting the spread of the virus rather than preventing it? Can you touch on the practice of wearing gloves? Well, I think a priority would be to wear a mask. Again, this is a respiratory disease, so that if you're coughing, that's when there's the opportunity to spread it. So having a mask on will help reduce the opportunity if you cough that you're spreading the virus. So a mask would definitely be a higher priority if you go out in public rather than gloves. Gloves may help you if you are avoiding touching your face because of it or something like that, or if you take them off after you've been out and throw them away, then maybe you're less likely to be able to spread it to yourself. But I would say a mask is definitely going to be a higher priority. I don't think it creates a false sense of security, but definitely the mask is going to be something that's going to be a higher priority. Julie Cornell, could you please ask Governor Ricketts when the Omaha Social Security office is going to reopen? My wife and son are on a K-1 visa, and we have to go to the office and do paperwork in person. This is putting us in a bad spot because we can't do our taxes, and she is unable to get a job because we don't have an SSN. So obviously the Social Security office, that's a federal government office. We haven't closed offices here in Nebraska. So they are free to be open. So I would suggest reaching out to the Social Security Administration to find out when they would want to open that office up, because there's no prohibition from the state level as far as them being open. So they can be open if they want, but we, the state, don't dictate to them when they have to be open. So that's a federal government office, so I'd refer you there. Delon Dillard, KETV. An inmate at Community Corrections in Omaha, along with another in Lincoln, has tested positive. Actually, that's not true. Only one in Omaha. There is no inmate in Lincoln that has tested positive. In addition to several staff members in Lincoln, why hasn't the governor mandated testing in all inmates in facilities where someone has been tested positive? Should the state of Nebraska be doing more to ensure inmates are safe? So, first of all, one of the things we got to remember with the testing is it's just a point in time. So, if somebody gets tested positive today or negative today, they could go out tomorrow and touch a door handle and get infected, right? So it's just a point in time. What we use the testing for is we test somebody. If they test positive, and we get that person to isolate, and then we do the contact tracing through their contacts to be able to get those people to quarantine and monitor their symptoms. And we determine who's getting that testing in a variety of ways we've talked about in the past. And the inmates are getting treated just like every other general member of the public. So if they are showing symptoms and they've been exposed to somebody, then they would get a test. And so, for example, that's what we did, with regard to the person the person in Omaha got tested because they went in for a medical procedure and got tested as part of the whole program there, and that's when we determined that they were positive. And so we've got a plan in place to be able to go through and look at the people they've been in contact with, and if anybody's showing symptoms, again, we'll be taking the appropriate steps to get those folks tested. So we're treating the inmates just like we're treating everybody else in Nebraska with regard to the priority for getting testing. And so, but I do want to remind people that testing is just a point in time. It doesn't prevent you from getting infected the next day, which is why we really reserve that for people who we know we want to, if they test positive, we want to get them to isolate. So we've got a plan for how to handle all this stuff, so the state is doing everything exactly appropriately to be able to handle our inmate population. Martha Stoddard, Omaha World Herald. If a baseball softball player or their household member becomes infected, does that team and the last team it played, or in the case of a tournament, maybe 3 or 4 teams, then shut down and isolate for 2 weeks? So with regard to that, that would work just like every other process. So for example, in June, once we start allowing practices in June 18th, when the games start, if somebody on the team would test positive, then our contact tracers would go out and go contact all the people they had been associated with for the last 2 weeks to be able to let them know that they potentially were exposed and that they should then quarantine and monitor their symptoms. So it would work exactly the same for those baseball or softball teams as it would anybody else. So it's just same process. So again, and those contact tracers would determine who was the close contact that we'd be recommending that those people would have to quarantine. Health officials in Sioux City, Iowa, said that yesterday that Nebraska did not report hundreds of coronavirus cases in Iowa residents that were discovered during the testing of meat producers, workers in Dakota County. What happened? Is there a reason that Nebraska would not share the information with the neighboring states? So as I mentioned earlier, whenever we bring on a new lab, we have to integrate them into our data stream and verify the data and all, make sure that all works. In this case of testing in Dakota City, a company had paid for that testing. It was not done, so they bought the test kits. That wasn't us at the state of Nebraska. They sent it to an out-of-state lab, wasn't one of our labs. And so we had to set up a protocol to be able to take that data and integrate it into our data stream here at Nebraska that then could be shared not only with our public health officials, but with the ones in Iowa. So on May 4th, we got a partial download from that lab with regard to the testing streams. And then we were able to verify all that. On May 8th, it was available to be shared with Iowa, but didn't get shared that day. That was a Friday. We discovered that on Monday, the 11th, and that's the day it was shared with Iowa. So again, it was just a process with regard to getting that lab set up on our data systems and then being able to share it with Iowa. So it's not like we were holding out in Iowa or anything like that. It was just a matter of the process to be able to take a new lab, get them set up on our system, make sure it was working, and then share it with Iowa. It could have been done on the 8th, but again, new system, so it didn't quite pick up. When we discovered it, we got shared on that Monday, the 11th. Andrew Butker, KCAU. Do you know if the governor will be addressing today, the Omaha tribe is currently limiting access to the city of Macy by utilizing checkpoints. As of today, they're only allowing residents and vendors access to the community. They aren't blocking Highway 75, but they are blocking other roads into the community. And again, as long as the Omaha tribe, first of all, let's take a step back. I think what the Omaha tribe is doing is trying to make sure they're protecting their folks there in Macy. And since they're not blocking Highway 75 and doing it in a way that is limiting access to that community, that's not blocking Highway 75, they're doing something that's appropriate to be able to do that. So, again, that's the tribe's decision to be able to do that and protect their members, and I'm sure they're doing it in the best interest of their members. So they're not interfering with anybody else in Nebraska, so there's no issue. Brandon Cortez, NTV, according to the New York Times, epidemiologists have said the U.S. are moving towards ending their lockdowns before it's wise to do so. Is ending the policies that have led to the progress in the country the best thing to do right now? So again, what we're doing here in Nebraska is a plan that's right for Nebraska. We took these steps early on in our cycle relative to some states like New York, who clearly had much more virus in them than we did. At the same time, we were taking about the same steps. And we've been able to flatten that curve down. It's not overwhelmed our healthcare system. And again, we cited the hospital data today. Here we are, a little over 2 months later. We've continued to preserve the healthcare system in Nebraska. Everybody's been able to get that hospital room, that ICU bed, that ventilator. And that's what we're going to continue to manage to. So again, all these epidemiologists, what they told us 2 months ago, you can't stop the virus from coming because it's a virus, nobody has immunity, but you can slow it down so that it doesn't overwhelm the healthcare system. We've done that, and as we start to loosen restrictions, we're going to continue to keep that in mind, that we focus on the healthcare system, preserving that healthcare capacity as we loosen these restrictions. So we're going to take them a step at a time, just gradually, to make sure that we don't impact that healthcare system, and that's what we're doing in Nebraska. That's the plan we'll continue to pursue here in our state. Nicole Ebat, KPTM. Now that Nebraska inmate has tested positive for COVID, has the governor reconsidered his stance testing and releasing nonviolent inmates? If no, why not? And Omaha, okay, so we'll get to those first of all. So again, just kind of the response already covered. The inmates are being treated just like everybody else. If they're showing symptoms and they've been exposed, they'll get tested. In this case, we've got a gentleman who tested as part of a medical procedure, so we will do the contact tracing. Anybody who's determined to be close contact will be notified, will be quarantining, all that sort of stuff. So we've got a plan in place for that, and this will just work like anybody else, and they'll be treated like anybody else in the member of the public. And then releasing nonviolent inmates, we have a process for that. It's called the parole system. And again, we don't want to release people before they've had the programming, because that means they will be more likely to reoffend and end up back in our system. So if they need certain anger management training or sex offender training, all those sort of things, we got to make sure we provide that before we actually release anybody. And so we're going to just continue to follow that same process that we've been following with regard to that. Okay, Taylor, I think that's all the questions I had written down. Did you have any others that were submitted?
Chris from NTV wants to know if county fairs can go on.
Chris from NTV wants to know if county fairs can go on. Again, we've got a team that's put together that's reviewing kind of the issues around county fairs and other larger gatherings as we look further into the summer to come up with some guidance on that. So I'd say stay tuned. We don't have a decision for you, but I will certainly let everybody know, look, folks, we're going to be managing this virus probably at least till the end of the year, if not into next year. And that means gatherings of large groups of people are going to be restricted in some way. So even if county fairs are allowed to go on, they will not look like the county fairs did last year. This is going to be different. Things are going to be modified. So I would just want to set everybody's expectations. Whatever they look like, they're not going to look like what they looked like last year.
Aaron from KMTV wants to know if we can get an update on long-term care facilities, case count and death count.
So they were looking, Aaron from where?
KMTV.
KMTV wanted to get an update on long-term care facilities. Dr. Antone, do you have those numbers? You can come up here and give us a briefing. Thanks.
So the long-term care facility numbers for today show that we have a total of 55 facilities affected, skilled nursing facilities, and 21 assisted living facilities that have either a staff member or resident that have tested positive. As of this morning, we have a total of 292 residents that have tested positive, a total of 223 staff members at these facilities tested positive, and 73 deaths at these facilities.
And those were all residents, no staff, is that correct?
No staff deaths, all deaths were residents, yes. So again, since we had 103 deaths reported today on our dashboard, it accounts for approximately 70% of our death rate here in Nebraska.
Dave Schroeder from Caravan wants to know, since we are opening up youth baseball, can we expand that to include high school rodeo activities with certain guidelines?
So Dave Schroeder, KRVM, wants to know that since we've taken some steps with regard to baseball and youth baseball and softball, we'll be able to open up high school rodeo. Not at this time. We're taking, again, get back to what I just said a couple minutes ago. We are loosening up restrictions, but we're doing it a step at a time to make sure that we preserve the healthcare system. So this is our first step on youth sports with regard to baseball and softball. We'll be revisiting some of those other issues with regard to, rodeo, high school rodeo. And that actually reminds me, I just missed a second part of the question here from Nicole Ebat from KPTM. So sorry, Taylor, I'm going to interrupt you a second. An Omaha strip club is asking why restaurants can open at half capacity with rules, and it cannot if owners space out clients and keep dance aways from customers. What's the difference? So again, same sort of answer. We're taking steps one at a time, slowly loosening restrictions at a time. We'll certainly review what with regard to strip clubs, with regard to when we loosen the restrictions on strip clubs. But this time, the answer is we're still keeping them closed, similar to bars. We're going to keep those areas closed as we start loosening restrictions to make sure that we can do this in a way to manage the healthcare system.
And then Bill Shammer from 1011 wants to know, do you have any guidance for adult rec leagues for baseball and softball? And do we have timelines for other sports?
So Bill Shamrock from 1011 wants to know, what about adult sports? And again, those are still being prohibited at this time. Taking this a step at a time, making sure that we don't, again, endanger the healthcare system. So we'll be considering adult sports down the road, but right now, just doing youth, baseball and softball.
And then finally,
And by the way, that's not this month either, that's next month, that's June.
Alexander Stone has questions about the positivity rate. She wanted to know what the positivity rate for our public health lab testing what that is and what the positivity rate for Test Nebraska is.
So Alexander Stone was wanting to know what is the test rate for the public health lab versus Test Nebraska. Dr. Antone, I know that, I mean, do you have those numbers? Do you have I don't know that we break those numbers out necessarily.
I mean, I follow them every day.
Do you want to just come up here and address that? Thanks.
So, you know, we've noticed our positivity rate, we check it every day. According to the non-Test Nebraska positivity rate, it was for a while up into the 20%, 25% per day positivity rate. We're noticing that it's starting to come down, and the reason for that, it just depends on where you're testing. When you're testing in high-risk areas, like meat processing plant areas, you're gonna have a higher positivity rate. So, but lately, our public health lab has been usually testing at right around 12 to 15% positivity rate on a daily basis.
Do you have the numbers for Test Nebraska?
I think the Test Nebraska, the last I heard, Governor, was around 7% or 3%?
I think overall it's about 3%.
3%, yes. Again, it depends on who you're testing, you know, if it's a high-risk area, like a meat processing plant area, long-term care facility, you're gonna have a higher positivity rate.
Numbers on Test Nebraska, what they tested yesterday, and how many?
We do.
Governor, do you have that?
We've received back 3,575 tests from Test Nebraska. Yesterday, we swabbed about 1,200 some people. So it was about the same as the previous day with regard to the number of people that we swabbed.
3,500 number, is that cumulative so far?
That's cumulative. 3,575 is the number, cumulative number of tests we've received back.
Or how many?
And the positives were 120?
That was from our
For Test Nebraska?
Public health lab and not Test Nebraska. I don't have the numbers for Test Nebraska positive.
Taylor's getting it. I think it was 120, actually. Is that right? No.
I know it was 120 for the non-Test Nebraska yesterday.
I was sorry, 121. Numbers just happen to be the same. Yeah, so 121 for Test Nebraska testing positive. And Taylor, do you happen to have the number of total swabs? Total swabs is what?
1278 for yesterday. I can give you cumulative too, though.
1278 for yesterday is the number of people we swabbed. So it was about the same as the day before.
Is there any plan to make that, put that on a dashboard somewhere so we can break out the Test Nebraska data versus the non-Test Nebraska?
We can certainly consider that. What we're more likely to do, what you're going to see starting tonight, is that all that data is going to be reflected in our published dashboard, so you'll see all the test results. So what you've been seeing up until now has been just the results from all the labs except Test Nebraska. So this will, starting tonight, Test Nebraska will be in there, so you'll see a big increase in the number of overall tests going in there. So, but we can certainly consider a separate dashboard on that too. Taylor, was there any other questions being texted in? No? Paul?
You're a data guy, and I got on the Test Nebraska website today and it called itself, said it would be offering comprehensive metrics. So I guess I'm curious why you're not collecting the positivity rate for those people who say, I've got symptoms. I mean, wouldn't that be an apples to apples comparison with your public health labs to tell you if these tests are accurate or not?
Yeah, so Paul's question is, why aren't you collecting positivity rates? We haven't been doing it for the public health labs, and maybe we can run into this by understanding. Last time we checked, we weren't breaking out that, we didn't collect that information for Test Nebraska either. So it's just not one of the things that the comprehensive metrics we're talking about. It was more things like how many swabs are we doing and what percent positives and that sort of stuff.
But are you testing any asymptomatic people?
So are we testing asymptomatic people with Test Nebraska? In the health labs? So again, you could be testing asymptomatic people in the health labs. So for example, when we work with some of the meat processors and they send us people, when they're encouraging their people to come take tests, that's a potential there that we're getting people who are asymptomatic as well as part of that. So yes, there are people who are asymptomatic that are being mixed into that. Or if we go to a community, like one of our rural communities, we may be getting asymptomatic people there too.
So people look at these numbers, 3% versus 17 or 18% last time I looked, and they say, how could that be? Are you continually testing Test Nebraska tests to make sure they're valid or accurate? What are you doing and who's doing it?
So again, people are asking questions, gee, Test Nebraska seems to be coming out at 3%. Dr. Anton just said 17%. What's the difference? Again, the difference is going in and testing high-risk areas with some of the tests we're getting back in our regular versus the kind of not so much. And are we revalidating Test Nebraska? Yes, we are. We've got a procedure to be able to go back and continue to validate the protocols or the testing that we're doing there too. So that's done by our folks at St. Elizabeth. That's the CLIA certified lab that is running the Test Nebraska lab.
It's not an independent group, it's,
Well, we work with the Nebraska Public Health Lab, so again, it's the same procedure we did before, where Nebraska Public Health Lab has samples they know are positive and negative. They send it to the lab that we've got working with CHI at St. Elizabeth's. They test them and make sure it comes out the same answer that Public Health Lab knows already.
so the St. Elizabeth's tests sound like they're being validated by St. Elizabeth people. Am I getting something wrong here?
So what happens is the Public Health Lab run tests in Omaha. They know the results of the test. They send then the samples to the St. Elizabeth people, who then run the tests and come up with their own answer. And then they check back with the Public Health Lab people to say, here's what we got, and make sure that the answers that St. Elizabeth has got actually match up with what Public Health Lab sent them.
That would be for the public health lab tests.
No. The Public Health Lab took samples they already had. They knew what the answer was because they tested, the Public Health Lab tested them, right? Then they, they sent them to St. Elizabeth, said, now you test them. We know what the Public Health Lab people was like, we know what the answer is, but we're not gonna give those to you. You come back and test us, tell us what you think the answers are, and we'll make sure they line up.
You know how frequently that's done? I mean, I know you all did.
We've been doing this a week and a half, Paul, so, there's a procedure in place. I don't know if they've actually gotten through that whole round of, the second down testing, but I know that's part of their policies or procedures, is to go back and make sure we're revalidating. But I know that they're planning on doing it. We can go back and check to see how far they are in that process.
Because I know they did that when you started.
Yeah.
Have they done that since you started?
I don't know the answer to that. I know that they're planning to, I just don't know if they've done it, but we can find out. Chris?
Yeah, there have been some other problems reported of people that, I guess Test Nebraska has said that they qualify for testing based on their symptoms, whatever, but then the website has told them that there are no time slots available. Public health districts are saying, no, there is, just come in and we'll do some kind of an override of the system and get you in. What's the problem there and what's being done to fix it?
Sure, that was a mistake by the local public health department person, because you can't go in and you have to schedule a test at a time to get in there. Now, we have worked, for example, with some facilities, so that if we were gonna say take food processing people in, which is part of our criteria to prioritize people, to be able to do that in an unscheduled way, but that was not open to the general public. And the person who in that district thought it was, made the mistake of trying to send other people there when that was not accurate. So that was a one-off issue. It happened just one time. I think we got that fixed so that everybody understands what the rules are. You have to actually schedule those appointments to be able to go to the Test Nebraska site.
The Grand Island Independent had an editorial that said that as part of the Test Nebraska program, the addresses of those tested did not transfer to the local health department, and there's no mechanism for providers to be notified because provider information is not requested when people register, and they said the state, under the direction of the governor, is failing Grand Island right now. What's your response?
Thanks. So what Fred's asking about is an editorial that was written in the Grand Island newspaper saying, hey, Test Nebraska is failing. I'd say, first of all, guys, week and a half, brand new program. We rushed this to get it out as quickly as possible. We certainly could have spent a month or two testing it, but we thought the better deal here was to make sure we got it out testing, even if it wasn't a perfect solution. We weren't gonna let the perfect be the enemy of the good here. Some of the stuff they're talking about with regard to provider information, we don't do that in general with any of our testing. So what we do is when we get a test, we'll send it back to the public health lab, and then we'll send it to the person, so the person we contact will let them know. They're the person, that person's information, so they need to provide, work with the provider to be able to do that. That's why we don't collect that provider information, because we have no intent of sharing with the provider. We have the intent of sharing with our public health lab and with the person who tests positive. And that's true for everybody. So that's not, and then also, one of the, just getting up the address and stuff. So again, I was talking about earlier with regard to getting the data streams integrated for any new lab. We had to do that with Test Nebraska too. That data is now being shared as of last night, so the editorial was a little premature with regard to that. I mean, yes, in a perfect world, we would have had all that ready to go. We could have waited to do that, but we thought the better program was to be able to go ahead and start getting that tested, because people were getting their information back individually. So it was better to go ahead with a good solution rather than a perfect solution to be able to, in the interest of getting more testing done here in the state. So again, just like with any new process, you're going to find things that you can improve upon. We've been working to do that as well here at the state of Nebraska, and we're going to continue to look for ways to improve upon it. So, as we find things that can be done better, we're going to do them better. But we made the trade-off of saying, better to get this out sooner, even if we have to go back and fix some things versus later.
2 last questions.
Okay, Lee over here.
You talked about a drug that I don't know how to say.
REM Desaver.
That exactly. Could you kind of explain, maybe Dr. Antone can as well, the validity, like what does that do? Why is it important to have?
Dr. Antone, I think that sounds like an excellent opportunity for you to come up here to talk about that drug.
Like, why is it important that we have access to that, and what can we see come from it?
The question is on REM Desaver, the new polymerase inhibitor, RNA polymerase inhibitor. Dates back to some of the other uses, even back to Ebola, where it was found to be somewhat useful against Ebola. Actually, at University of Nebraska Medical Center, the initial trials were done by Dr. Khalil. And after having 1,063 patients that were randomized to either get remdesivir or not, get a placebo, and it was a randomized controlled blinded trial, they found that the patients that did receive remdesivir had about a 30% decrease in the amount of stay in the hospital, from about 15 days to 11 days in the hospital before they were discharged. And it showed a trend toward the decrease in mortality or death, from about 12% mortality rate down to about an 8% mortality rate. So it was enough evidence for them to go ahead and start the use of remdesivir for these patients. So they just allocated us the supply yesterday. We're setting up the guidelines now for use, and we think it's probably going to be somewhat useful as far as helping patients. We don't know exactly what course of the disease it's going to be best used for. That's something we'll try to determine here over the next few weeks maybe, whether you should use it early on or wait till later on. Those will all be worked out. But for now, it's probably going to be of use for some patients.
I mean, it seems like anything that can help in the right direction is good for us at this point. Can you kind of just comment about how nice it is to see maybe some headway being made in the direction of helping out kind of thing?
So Lee asked the question of just having a medicine or some sort of a help with these patients. I think it does add a lot. I think it does give people hope, and I think it gives doctors hope too. And I know that's why a lot of doctors want to use it now, is because they want to give all patients the best chance they have to try to get through. And usually it'll be patients that are having trouble getting off the ventilators or even needing that extracorporeal membrane oxygenation, where you need actually a machine to help oxygenate your blood. That's where we think it'll be somewhat useful.
Thank you, Dr. Aaron. Paul?
Any other steps now that we've had 212 workers at the Madison hog processing plant test positive, and such a large number? Are you planning any other steps to deal with these kind of outbreaks in meatpacking?
So the question was, with regard to the number of people testing positive at the Madison facility, food processing facility there, are we contemplating other steps? Again, we're continuing to work with all the food processors with regard to what the best practices are. I think I've referenced UNMC's Global Health Centers published their meat processors COVID-19 playbook, and that's a continually evolving playbook. So as we learn things, that gets updated, and we share that with the food processors. We have weekly calls to be able to reinforce that. We talk about other things too, like best practices around whether it's short-term disability or paying people to stay home or anything along those lines. So I think part of it is we kind of have a kind of the broad outline. We'll continue to make improvements to that as we find additional things that are going to be better. But part of it is just working that playbook that we've got already to make sure that the meat processors are doing all they can within their facilities to be able to put up the plexiglass barriers or the plastic at lunch or changing their air handling conditions, or sanitizing high-touch surfaces more often, or putting more hand sanitizers. I mean, there's a lot of things just with regard to making sure all our facilities are following along with those guidelines to be able to make sure we take the steps to make those environments as safe as possible for the people who are working there. All right, folks, well, again, thank you very much. Appreciate everybody coming here this afternoon to talk about what we're doing here to slow the spread of virus here in our state. I want to thank all the Nebraskans who are taking those steps, who are making those sacrifices. What you're doing is working. We've preserved the healthcare system. As we start to loosen these restrictions, we're going to continue to keep that focus on our hospital system to make sure that everybody who needs that hospital bed, that ICU bed, that ventilator can get access to it. And that is how we will know that we are continuing to win the battle here against coronavirus. Thanks again, and we'll see you all here tomorrow afternoon at 2 p.m. Central. Thanks.